Welcome to our journey into mindfulness. In the next minutes, we will explore techniques and practices to bring more peace and awareness into your daily life. Find a comfortable place, relax, and let's begin. Mindfulness has its roots in ancient Buddhist practices but has been increasingly integrated into Western psychological practices over the past few decades. The surge in interest can be attributed to its promising benefits for mental health and cognitive functioning. Several theoretical models explain how mindfulness exerts its effects, including the attention regulation model, the decentering model, and the emotional regulation model. Each model is examined to understand the mechanisms underlying mindfulness practices. The attention regulation model of mindfulness posits that the benefits of mindfulness practices primarily arise from improved attention regulation. This model suggests that mindfulness enhances one's ability to control and direct attention, leading to several psychological and cognitive benefits. Here's a summary of the key components and mechanisms of the attention regulation model. Focused attention. Mindfulness practice involves focusing attention on a specific object, such as the breath, and sustaining this focus over time. This helps develop the ability to concentrate and maintain attention on a chosen target. Attentional switching. Mindfulness enhances the ability to shift attention flexibly and efficiently. Practitioners become better at switching their focus between different tasks or stimuli without becoming overly distracted. Attentional inhibition. Mindfulness improves the ability to inhibit distractions and irrelevant thoughts. Practitioners learn to recognize distractions and let them go, returning their focus to the intended object of attention. Improved awareness. By training attention, mindfulness increases awareness of present moment experiences. This heightened awareness helps individuals notice when their mind has wandered and bring it back to the present. Reduced cognitive reactivity. Enhanced attention regulation reduces the tendency to react automatically and emotionally to thoughts and stimuli. Instead, individuals can observe their thoughts and feelings non-judgmentally, leading to a more measured and deliberate response. Enhanced cognitive control. Regular mindfulness practice strengthens cognitive control processes, such as working memory and executive functioning. This helps in better managing cognitive resources and improves problem-solving and decision-making skills. Reduced stress. By improving attention regulation, mindfulness helps break the cycle of rumination and worry that often leads to stress. Practitioners are better able to stay focused on the present rather than being caught up in anxious thoughts about the past or future. Improved emotional regulation. Enhanced attentional control allows individuals to observe their emotions without being overwhelmed by them. This leads to greater emotional stability and resilience. Better cognitive performance. Improved attention regulation leads to better performance on tasks that require sustained focus, such as studying, working, or performing complex tasks. Clinical interventions. Mindfulness-based therapies such as mindfulness-based stress reduction, MBSR, and mindfulness-based cognitive therapy, MBCT, leverage attention regulation to help individuals manage conditions like anxiety, depression, and chronic pain. Educational settings. Mindfulness programs in schools teach students attention regulation skills, which can enhance their academic performance and emotional well-being. Workplace training. Mindfulness interventions in the workplace focus on improving employees' attention regulation, which can reduce stress and increase productivity. In summary, the attention regulation model highlights the central role of enhanced attentional control in achieving the psychological and cognitive benefits associated with mindfulness practices. By improving the ability to maintain, shift, and inhibit attention, mindfulness helps individuals manage stress, regulate emotions, and improve cognitive functioning. The decentering model of mindfulness emphasizes the process of stepping back from one's thoughts and feelings and viewing them as temporary and objective events, rather than as reflections of reality or self-identity. This shift in perspective, known as decentering, is central to the psychological benefits of mindfulness practice. Here's a summary of the key components and mechanisms of the decentering model. Observing thoughts and feelings. In mindfulness practice, individuals learn to observe their thoughts and emotions without getting caught up in them. This observation is non-judgmental and involves recognizing that thoughts and feelings are transient and do not define the self. Detachment from thought content. Decentering involves detaching from the content of thoughts and seeing them as mental events that come and go. This detachment reduces the emotional impact of negative thoughts and helps individuals respond more calmly and rationally. Metacognitive awareness. This refers to the ability to reflect on one's own thought processes. Mindfulness enhances metacognitive awareness, allowing individuals to understand that thoughts are not always accurate or reflective of reality. Reduced cognitive fusion. Cognitive fusion is the process of being entangled with one's thoughts and believing them to be true. Decentering reduces cognitive fusion, helping individuals see thoughts as mere mental events without attaching undue significance to them. Increased psychological flexibility. By decentering, individuals become more psychologically flexible, which means they can adapt more easily to different situations and respond to challenges with greater resilience. Improved emotional regulation. Decentering allows individuals to manage their emotional responses better by reducing the intensity and duration of negative emotions. It helps in viewing emotions from a distance, which diminishes their impact. Reduced anxiety and depression. Decentering helps individuals avoid ruminative and self-critical thought patterns that contribute to anxiety and depression. By seeing these thoughts as temporary and not personally significant, individuals can alleviate symptoms of these conditions. Enhanced stress management. Viewing stressful thoughts and feelings as passing events reduces their power and helps individuals cope more effectively with stress. Better coping strategies. Decentering promotes healthier coping mechanisms by encouraging a non-reactive stance towards negative experiences, leading to more thoughtful and deliberate responses. Therapeutic settings. Therapies like mindfulness-based cognitive therapy, MBCT, and acceptance and commitment therapy, ACT, use decentering techniques to help clients manage mental health issues by changing their relationship with their thoughts and feelings. Educational programs. Mindfulness programs in schools teach decentering skills to help students manage academic stress and emotional challenges. Workplace interventions. Mindfulness training in the workplace incorporates decentering to help employees deal with job-related stress and improve overall well-being. The decentering model highlights the importance of viewing thoughts and emotions as temporary and objective events, rather than as definitive aspects of reality or self-identity. This perspective shift, facilitated by mindfulness practice, can significantly enhance psychological well-being by reducing the emotional impact of negative thoughts, improving emotional regulation, and increasing psychological flexibility. By incorporating decentering techniques into various settings, individuals can develop healthier ways of coping with stress, anxiety, and other mental health challenges. The emotional regulation model of mindfulness focuses on how mindfulness practices enhance the ability to manage and modulate emotional responses. This model suggests that mindfulness can improve emotional regulation through several key mechanisms, leading to better mental health and well-being. Here's a summary of the key components and mechanisms of the emotional regulation model. Awareness of emotions. Mindfulness practice increases awareness of one's emotional states. Practitioners learn to recognize and acknowledge their emotions without immediate reaction or suppression. Non-judgmental acceptance. Mindfulness encourages accepting emotions as they are, without judging them as good or bad. This acceptance reduces the tendency to react impulsively or defensively. Present moment focus. By bringing attention to the present moment, mindfulness helps individuals experience emotions as they occur, rather than dwelling on past events or anticipating future problems. Increased emotional clarity. Mindfulness enhances the ability to clearly identify and understand one's emotions. This clarity helps in recognizing the underlying causes of emotional responses and addressing them more effectively. Reduction of emotional reactivity. Mindfulness practice reduces automatic emotional reactions. Practitioners become less likely to react intensely to emotional triggers, leading to more balanced and measured responses. Improved emotional recovery. Mindfulness helps individuals recover more quickly from negative emotional experiences. By observing emotions without attachment, individuals can let go of negative feelings more easily. Enhanced positive emotions. Mindfulness not only helps in managing negative emotions, but also increases the experience of positive emotions, such as joy, contentment, and gratitude. Reduced anxiety and depression. By improving emotional regulation, mindfulness can alleviate symptoms of anxiety and depression. Individuals learn to manage their emotional responses better and reduce ruminative thought patterns. Decrease stress. Mindfulness helps manage stress by reducing emotional reactivity and increasing resilience. Practitioners can approach stressful situations with greater calm and clarity. Improved relationships. Better emotional regulation leads to healthier interpersonal relationships. Individuals can respond to others with greater empathy and understanding, reducing conflict and enhancing communication. Clinical interventions. Mindfulness-based therapies such as mindfulness-based stress reduction, MBSR, and dialectical behavior therapy, DBT, use emotional regulation techniques to help clients manage mood disorders and emotional dysregulation. Educational programs, mindfulness programs in schools teach students emotional regulation skills, which can improve their emotional well-being and academic performance. Workplace training, mindfulness interventions in the workplace focus on emotional regulation to help employees manage job-related stress, improve emotional intelligence, and increase overall productivity. The emotional regulation model highlights how mindfulness enhances the ability to manage and modulate emotional responses. By increasing awareness of emotions, promoting non-judgmental acceptance, and fostering a present-moment focus, mindfulness helps individuals achieve better emotional clarity, reduce emotional reactivity, and recover more quickly from negative experiences. These benefits contribute to overall mental health and well-being, making mindfulness a valuable tool in clinical, educational, and workplace settings. Mindfulness-based interventions, MBIs, have been shown to significantly reduce symptoms of anxiety. Research indicates that mindfulness can be a powerful tool in alleviating depressive symptoms. Mindfulness practices enhance attention and concentration by training individuals to focus on the present moment. Evidence suggests that mindfulness can improve memory and learning processes. Mindfulness has been linked to improvements in executive functions, such as working memory, cognitive flexibility, and inhibitory control. Mindfulness has been integrated into various therapeutic approaches, including MBSR, mindfulness-based cognitive therapy, MBCT, and acceptance and commitment therapy, ACT. Mindfulness programs have been implemented in schools to enhance students' mental health and academic performance. Mindfulness has been introduced in workplaces to reduce stress and improve productivity. Mindfulness practices have also been applied in community and healthcare settings to promote overall well-being. Mindfulness is the practice of being fully present and engaged in the moment, aware of your thoughts and feelings without distraction or judgment. Originating from ancient meditation practices, mindfulness has been shown to reduce stress, improve focus, and enhance overall well-being. Research has shown that mindfulness can have profound effects on the brain and body. Studies indicate that regular practice can increase gray matter in areas associated with memory, learning, and emotional regulation, while reducing activity in the amygdala, the brain's stress center. Let's explore some basic mindfulness techniques. Start with mindful breathing. Find a comfortable seat, close your eyes, and focus on your breath. Notice the sensation of air entering and leaving your nostrils. If your mind wanders, gently bring your attention back to your breath. Next, try a body scan. Slowly move your attention through your body, starting from your toes and moving up to your head. Notice any sensations, tension, or relaxation without judgment. Mindfulness can be integrated into daily activities. When walking, pay attention to the sensation of your feet touching the ground, the rhythm of your steps, and the sounds around you. Mindful eating involves savoring each bite, noticing the flavors, textures, and aromas. Eat slowly and appreciate your food fully. Incorporating mindfulness into your daily routine can transform your life. Start with small moments, while brushing your teeth, waiting in line, or during a commute. Simply bring your full attention to the present moment and observe without judgment. Let's finish with a guided mindfulness meditation. Find a comfortable position, close your eyes, and take a few deep breaths. As the meditation ends, slowly bring your attention back to the room. Open your eyes and take a moment to appreciate this state of mindfulness. Thank you for joining this mindfulness session. Remember, mindfulness is a journey, not a destination. Practice regularly and you'll gradually experience more peace and clarity in your life. If you enjoyed this video, please like, subscribe, and share with others who might benefit.